Welcome to our first assessment. When I have a new client come to visit me, the first thing we do in our first session is assessments. I do not have them do necessarily any exercises, although, as I mentioned in the introduction, there's a gray area between assessment and exercise. And so in a way, the assessments are a bit of an exercise. But everything is performed with the specific intention of gathering data at this level. So when they come in, I'll welcome them in. I'll make sure that they're comfortable. It smells nice. It's calming atmosphere. I got some good music playing, that type of thing. And I just want the person to be very relaxed. Okay. I don't want them to come in and feel like it's chalk and dirt everywhere and it's, like a CrossFit gym with sweat all over the floor or something like that. I want it to be a good experience. And then part of that is relevant to what I'm going to tell you. That I will welcome them in, take a few minutes. Eventually, when we're ready to begin the assessment, what I'm going to have them do is I'm going to have them lay down on their back on my therapy table, and I'm going to say, what I would like you to do is close your eyes and just relax for a minute or two while we prepare to start our assessments. Something to that effect. What I'm trying to get them to do is relax without knowing that right now I'm actually going to be assessing something on them. Because if they know what I'm assessing, they will try to pass the assessment. Okay? So I want their eyes closed so that they don't see that I'm looking straight at their tummy. And I'm going to have them lay there. I'm going to sit back a little bit, and I'm going to watch from the profile view. I'm going to watch and see what their breathing pattern looks like. Okay? If I see that they have a nice belly breath just naturally, they're not doing this to impress me, they're not doing it to pass the assessment, they don't really know what I'm assessing, but I want to know is that belly rising and falling with their breath? I'm also going to take note of whether or not this person is hyperventilating or more unlikely hypoventilating, meaning too many breaths within a certain time period. If they're hyperventilating, that's generally because they're taking very shallow breaths, and so they're taking a lot of shallow breaths. I want to take a note of that. Generally, if they are hyperventilating, it's also not just coupled with shallow breathing, it's also coupled with upper respiratory breathing, not belly breathing. Okay, so this is what I'm assessing right now. I'm assessing, do you breathe naturally into your belly or into your chest? And what is the breathing rate? Those are the two things I really want to find out. And I can usually see it pretty quickly within about 20 to 30 seconds. But, I might stay there for a minute or 90 seconds to really make sure I'm getting the full picture. Then what I might do is ask the person, especially if they're failing at this level, chest, hyperventilating, I might say, what I would like you to do for me is I would like you to make sure you're breathing through your nose, inhale and exhale, and please try to breathe into your belly. So I know that involuntarily they have not passed the assessment, but what happens when they consciously try to correct the breathing pattern? Does that solve the problem? Okay, and this is the information that I want you guys to have. Okay, about yourself. I want you to know, what is my usual breathing pattern? Do I chest breathe and maybe hyperventilate, or do I breathe into my belly when I'm relaxed? If I do hyperventilate in inverted breathing pattern, when I lay on my back and I try to focus on it, how easy is it for me to correct that? Okay, so this is the information that we want. So what I will do is I want to keep these videos as short as possible, but I want to tell you why this is so important. Obviously you might say, well, yeah, it makes sense that I have to be able to breathe properly to be able to train with kettlebells or to be able to exercise properly. And it's true. Obviously, just to get good oxygen into your body and be able to perform, you need to be able to breathe well. But there's far more to it than that. The breathing muscles, especially the diaphragm, the transverse abdominis, and also the pelvic floor, these are all muscles of inhalation and exhalation. These muscles are not just primary muscles of breath, they are also deep core stabilizer muscles. So if you are not using those muscles for 20,000 reps or more per day for breathing, then those muscles, they lose their tone, they lose their strength, they lose their neural connection. The nervous system stops firing them properly. And so not only do they get weak, but they also fall asleep, right? And so when those muscles fall asleep, you become what we call an injury waiting to happen. Your core is now unstable because the most important core stabilizers are not tone. They are not doing their job. So that's why it's so important that we get your breathing pattern correct, so that every breath that you take is creating tone, as well as many other benefits of belly breathing, by the way, but creating tone in those muscles that are so extremely important from a safety standpoint in any level of performance in your life. Not just weightlifting, taking out the trash, or tying your shoes. I hear of injuries of people tying their shoes all the time. Without further ado, let's move on. You understand what I'm saying. For this assessment, I want you to have a water bottle. It's all you need, okay? We're gonna lay on our back, and you're gonna put that water bottle on your belly button. Now you're gonna tuck your chin just ever so slightly. And you're gonna look down your cheekbones to the top of that water bottle. It should be empty or very light, preferably. And then with your hand, you're going to very gently make a circle around that water bottle, but allowing the water bottle to have plenty of movement up and down. And then you're going to inhale. And exhale. And you're going to watch the top of that water bottle. And you're also going to feel it moving in your loose grip fingers, okay? And you're going to see when I'm consciously, obviously we're consciously focusing on our breathing here. There's no way we're not, you know what we're assessing. So we're going to see in a voluntary situation, can I breathe into my belly? Can you feel that water bottle rise and fall as the breath inhales and exhales? The entire inhale, you want that bottle climbing. The entire exhale, you want that bottle falling. As long as you're taking a normal breath, we're not trying to fill the lung capacity. So about a 2/3 breath, that will be pretty much all just in the belly, okay? And so you should feel the water bottle sliding up and down the entire duration of each phase of the breath. If you say, okay, yeah, no problem, voluntarily, I can do that, you can also then just continue the assessment by going to the extreme of full breath in and full breath out and see how much travel you can get. And you notice when you get the breath out, that muscle that actually exhales, that primary muscle of exhalation is the transverse abdominis. It's like a corset, like a weight belt around your waist. When it cinches and pushes the air out, you'll feel that muscle contract. And that's a really good sign if on that exhalation, you feel that TVA getting nice and contracted. So perform this assessment. Again, this is conscious awareness on our breath. This is voluntary, which is to say that I also encourage you, and I would at this level, what I want you to do is I want you to draw your attention and bring your attention to your breath as much as you can throughout the day, and ask yourself honestly, am I chest breathing or am I belly breathing? Another question you can ask yourself is, am I mouth breathing or nasal breathing? If you are mouth breathing, that nearly always results in an upper respiratory breathing pattern over time. So the chest is filling, it's rising and falling, shoulders are rising and falling with every breath, but the belly is not expanding, okay? If this is you, we have to solve this before we progress to extrinsically loaded exercises. You can still do the work on the Swiss ball, you can still do the work with the deep core stabilizers, but we're not going to move into highly integrated, even body weight exercises quite yet, and certainly not extrinsically loaded exercises quite yet. We want to solve this because the breathing pattern is the most important thing that we can work on. It is the foundation of all of your movements, and if you take any exercise and regress it down to its most basic exercise, its most basic form, you come up with breath, okay? So we're gonna rehabilitate this if it needs to be rehabilitated. If you pass this with flying colors, you don't need to do these coming exercises. Go to the next assessment and let's keep going.